Hey guys, come along with me today to inject this patient. As you can see, we are prepping for neurotoxin and we have the patient also numbing for a little bit of a lip enhancement. So as you can see, I'm marking up that frontalis. I marked those lateral borders of that frontalis and now I'm evenly spacing where I'd like to inject across that frontalis. As you notice, I have a dot directly on that lateral border. That is to prevent any spocking. You want to treat all the way over to that lateral border to ensure that you're not going to spock the patient's brow. I always evenly spread my dots in order to get a good diffusion. When injecting, I'm going at a 45-degree angle and I'm using about half of my needle depth. I'm injecting around those dots, never through them, and I'm using those dots for guidance. I always tell people you're not married to your markings. You just want to use them kind of for guidance to make sure that you're getting a nice even spread all the way across that frontalis. So as you can see, I'm working in a fashion that makes sense to me. I'm working all the way from the left to the right of the patient. I always tell everyone it doesn't matter how you go about injecting the frontalis as long as you're not going to miss any of those injection sites. And even if you do, it's okay. It's just that you have to kind of assess as you go of where you'd like to inject in order to get the best results. So as you can see, I'm really pulling that tissue taut, injecting at a 45-degree angle, about half needle depth, and I'm working all the way over to that other lateral border. I'm also injecting right on that lateral border to prevent any spocking. As you can see, we're now moving on to the glabella complex. So this area is made up of 5 muscles. It's the procerus and the medial and lateral corrugator on each side. That procerus is made of a really strong muscle, and when contracted, it creates that horizontal line on the bridge of the nose. When you're contracting, you have those Levina lines. Those are those corrugators that are pulling in towards the center of your eyes. This injection is really important that you watch your needle depth. You don't want to be too deep because then you can hit the frontalis underneath and you can drop a brow. Moving on to a lip flip, we are making sure that we are right on that edge of that vermilion border, and this injection is very superficial. The patient only needed this treatment on the top lip, so I really focused on there. This injection is very pinchy, so please educate your patient on what to expect.